Struggling with pharmacology? In the next few minutes, Nclex Made Easy 91 will help you master 50 Nclex-style drug questions you can't afford to miss.
1. A nurse is caring for a client taking warfarin for atrial fibrillation. Which food should the nurse teach the client to limit? A. Bananas. B. Spinach. C. Apples. D. Rice. Answer: B. Spinach. Rationale: spinach is high in vitamin K, which can reduce warfarin's anticoagulant effect. Strategy: for anticoagulants, remember vitamin K equals knockdown effect. 2. The nurse is preparing to administer furosemide to a client with heart failure. Which lab value is the priority to assess before giving the drug? A. Sodium. B. Potassium. C. Hemoglobin. D. Platelets. Answer: B. Potassium. Rationale: loop diuretics can cause hypokalemia, increasing the risk of dysrhythmias. Strategy: think furosemide flushes potassium. 3. SADA. Which of the following are expected side effects of morphine sulfate? A. Respiratory depression. B. Constipation. C. Hypotension. D. Urinary frequency. E. Pupillary dilation. Answer: A, B, C. Rationale: morphines depress CNS, slow bowel movement, lower BP, and cause meiosis, not dilation. Strategy: remember, morphine makes you move less. 4. A client with asthma is prescribed albuterol inhaler. What statement by the patient indicates a need for further teaching? A. I will use my inhaler before exercise. B. I can take it every 4 hours if needed. C. I should rinse my mouth after using it. D. It helps open my airways quickly. Answer: C. I should rinse my mouth after using it. Rationale: rinsing the mouth is essential after corticosteroids inhalers, not albuterol. Strategy: know which inhalers need mouth rinsing. Steroids, not bronchodilators. 5. Dosage calculation. The order is for amoxicillin 500 milligrams PO every 8 hours. The drug comes in 250 milligram tablets. How many tablets per dose will the nurse administer? Answer: 2 tablets. Rationale: 500 divided by 250 equals 2 tablets. Strategy: divide the prescribed dose by the available dose. 6. A patient prescribed digoxin reports heart rate of 88 beats per minute. Which finding requires the nurse to withhold the medication and notify the provider? A. Heart rate of 88 beats per minute. B. Heart rate of 54 beats per minute. C. Blood pressure of 110 over 70 millimeters mercury. D. Potassium level of 4.2 milliequivalents per liter. Answer: B. Heart rate of 54 beats per minute. Rationale: digoxin should be withheld if HR is below 60 beats per minute to prevent bradycardia. Strategy: always check apical pulse for 1 full minute before giving digoxin. 7. A nurse is providing education for a patient starting levothyroxine. Which statement indicates the patient understands the teaching? A. I should take this medication with food. B. I will take this medication in the morning on an empty stomach. C. I can stop taking it once I feel better. D. I will take it at night before bed. Answer: B. I will take this medication in the morning on an empty stomach. Rationale: levothyroxine is best absorbed on an empty stomach in the morning. Strategy: think levo, leave it alone with food. 8. SADA. Which are signs of lithium toxicity? A. Tremors. B. Confusion. C. Polyuria. D. Bradycardia. E. Hyperactivity. Answer: A, B, C. Rationale. Lithium toxicity presents with tremors, confusion, excessive urination, and possible GI distress. Strategy. LITH. Lethargy, increased urination, tremor, headache, or confusion. 9. A patient receiving heparin infusion develops bleeding gums. What is the antidote for heparin toxicity? A. Vitamin K. B. Protamine sulfate. C. Atropine. D. Naloxone. Answer B. Protamine sulfate. Rationale. Protamine sulfate binds to heparin and neutralizes its anticoagulant effect. Strategy. Hep equals help with protamine. 10. A nurse is preparing to give insulin lispro to a patient before lunch. When should the nurse administer the dose? A. 30 minutes before eating. B. Immediately before eating. C. 2 hours before eating. D. At bedtime. Answer B. Immediately before eating. Rationale. Lispro is rapid-acting and should be taken right before meals to prevent hypoglycemia. Strategy. Lispro, let's eat pronto. 11. A nurse is providing education for a client on nitroglycerin sublingual tablets. Which instruction is correct? A. Swallow the tablet with water. B. Place the tablet under your tongue until it dissolves. C. Chew the tablet for faster absorption. D. Store the tablets in a pill organizer. Answer B. Place the tablet under your tongue until it dissolves. Rationale. Nitroglycerin is absorbed directly into the bloodstream under the tongue. Strategy. Nitro equals no swallowing. 12. A patient prescribed enalapril reports a persistent dry cough. What should the nurse do? A. Reassure the patient this is normal. B. Suggest the patient stop taking the drug immediately. C. Notify the provider for possible medication change. D. Advise the patient to drink more fluids. Answer C. Notify the provider for possible medication change. Rationale. A persistent dry cough is a common side effect of ACE inhibitors and may require switching to another class. Strategy. ACE equals a coughing effect. 13. A patient receiving gentamicin develops tinnitus. What should the nurse do immediately? A. Tinnitus. B. Nausea. C. Fatigue. D. Headache. Answer A. Tinnitus. Rationale. Tinnitus may indicate ototoxicity, a serious adverse effect of aminoglycosides. Strategy. Gentamicin equals gentle on infection, rough on ears. 14. SADA. Which lab results should be monitored for a patient on vancomycin? A. BUN or creatinine. B. Platelets. C. INR. D. AST or ALT. Answer A and B. Rationale. Vancomycin can cause nephropathy, so kidney function tests are essential. Strategy. Vanco equals verify kidney function. 15. The nurse is preparing to give metoprolol. Which assessment is most important before giving the dose? A. Respiratory rate. B. Apical pulse. C. Oxygen saturation. D. Capillary refill. Answer B. Apical pulse. Rationale. Beta blockers can cause bradycardia and should be held if HR is too low. Strategy. Beta blockers block the beat.
16. A patient prescribed phenytoin asks about oral care. Which advice is correct? A. Floss less often. B. Visit the dentist regularly for gum health. C. Avoid brushing daily. D. Use mouthwash only. Answer B. Visit the dentist regularly for gum health. Rationale. Phenytoin can cause gingival hyperplasia, requiring good dental care. Strategy. Phenytoin equals puffy gums. 17. A nurse is giving potassium chloride IV. Which action is essential? A. Administer rapidly. B. Dilute and give slowly via pump. C. Give undiluted for better absorption. D. Mix with dextrose. Answer B. Dilute and give slowly via pump. Rationale: rapid potassium infusion can cause fatal cardiac arrhythmias. Strategy: potassium equals push slow. 18. A client taking isoniazid for TB should be taught to avoid which food? A. Grapefruit. B. Cheese. C. Chocolate. D. Soy milk. Answer B. Cheese. Rationale: isoniazid with tyramine-rich foods like cheese can cause hypertensive crisis. Strategy: isoniazid equals iso, avoid cheese. 19. The nurse is preparing to give methotrexate. Which lab value is most important to review? A. White blood cell count. B. Potassium level. C. Blood glucose. D. Sodium level. Answer A. White blood cell count. Rationale: methotrexate is an immunosuppressant that can cause bone marrow suppression. Strategy: methotrexate equals monitor marrow. 20. A patient taking atorvastatin reports muscle pain. What should the nurse do first? A. Reassure the patient. B. Document and ignore. C. Notify the provider immediately. D. Advise taking pain medication. Answer C. Notify the provider immediately. Rationale: muscle pain may indicate rhabdomyolysis, a serious statin side effect. Strategy: statins equals stop if sore. 21. A patient on spironolactone should avoid which food to prevent hyperkalemia? A. Apples. B. Bananas. C. Rice. D. Lettuce. Answer B. Bananas. Rationale: spironolactone is potassium sparing. High potassium foods can cause dangerous levels. Strategy: spironolactone equals spare potassium. 22. Before giving clopidogrel, which assessment is most important? A. Bowel sounds. B. Platelet count. C. Pupillary reaction. D. Blood glucose. Answer B. Platelet count. Rationale: clopidogrel inhibits platelet aggregation. Low platelet count increases bleeding risk. Strategy: clopidogrel equals clots don't grow. 23. A patient on rifampin should be warned about which harmless side effect? A. Blue urine. B. Orange body fluids. C. White stools. D. Gray vision. Answer B. Orange body fluids. Rationale: rifampin causes harmless orange discoloration of tears, sweat, and urine. Strategy: rifampin equals red-orange. 24. Which statement by a patient taking alendronate for osteoporosis requires further teaching? A. I will take it with a full glass of water. B. I will lie down right after taking it. C. I will take it on an empty stomach. D. I will sit upright for 30 minutes after taking it. Answer B. I will lie down right after taking it. Rationale: lying down increases the risk of esophageal irritation. Strategy: alendronate equals alone, upright with water. 25. Which is the antidote for opioid overdose? A. Flumazenil. B. Protamine sulfate. C. Naloxone. D. Vitamin K. Answer C. Naloxone. Rationale: naloxone rapidly reverses opioid-induced respiratory depression. Strategy: N for narcotic reversal. 26. A patient on cyclosporin should avoid which drink? A. Milk. B. Coffee. C. Grapefruit juice. D. Green tea. Answer C. Grapefruit juice. Rationale: cyclosporin increases cyclosporin levels, raising toxicity risk. Strategy: cyclosporin equals cycle away from grapefruit. 27. Which teaching is essential for a client taking sucralfate for peptic ulcer disease? A. Take with meals. B. Take on an empty stomach. C. Take with antacids at the same time. D. Take before bedtime only. Answer B. Take on an empty stomach. Rationale: sucralfate forms a protective barrier on ulcers when stomach is empty. Strategy: sucralfate equals surface shield. 28. A patient is prescribed diltiazem. Which condition would be a reason to hold the dose? A. Blood pressure 150/90 mmHg, heart rate 52 BPM, C. Temperature 99 degrees Fahrenheit, respiratory rate 18 per minute. Answer B. Heart rate 52 BPM. Rationale: calcium channel blockers can cause bradycardia. Strategy: diltiazem equals dial down heart rate. 29. The nurse is about to administer ondansetron. This medication is used to treat which condition? A. Nausea and vomiting. B. Diarrhea. C. Constipation. D. Indigestion. Answer A. Nausea and vomiting. Rationale: ondansetron is a serotonin antagonist antiemetic. Strategy: ondansetron equals on to vomit. 30. A patient taking captopril should be monitored for which electrolyte imbalance? A. Hypokalemia. B. Hyperkalemia. C. Hyponatremia. D. Hypercalcemia. Answer B. Hyperkalemia. Rationale: ACE inhibitors increase potassium retention. Strategy: ACE equals add K.
31. Which lab test is most important to monitor for a patient taking warfarin? A. PTINR. B. APTT. C. Platelets. D. Hematocrit. Answer A. PTINR.
Rationale: warfarin effectiveness and bleeding risk are monitored with PGIMER. Strategy: warfarin equals watch PGIMER. 32. A patient taking amiodarone develops bluish skin discoloration. What should the nurse do? A. Document as harmless side effect. B. Stop the medication immediately. C. Administer oxygen. D. Call a code. Answer A. Document as harmless side effect. Rationale: amiodarone can cause harmless blue-gray skin changes with long-term use. Strategy: amiodarone equals a mix of colors. 33. Which teaching is correct for a patient using a transdermal fentanyl patch? A. Apply to broken skin for faster absorption. B. Heat the patch to improve drug delivery. C. Remove old patch before applying a new one. D. Cut the patch to adjust the dose. Answer C. Remove old patch before applying a new one. Rationale: multiple patches can cause overdose. Strategy: one patch at a time. 34. A patient prescribed allopurinol for gout. Which statement shows correct understanding? A. I should start taking it during an acute gout attack. B. I will drink plenty of water while taking this medication. C. I should limit my fluid intake. D. I can stop once the pain goes away. Answer B. I will drink plenty of water while taking this medication. Rationale: hydration prevents kidney stones when taking allopurinol. Strategy: allopurinol equals all-out hydration. 35. Which adverse effect is most concerning for a patient taking clozapine? A. Weight gain. B. Sedation. C. Agranulocytosis. D. Dry mouth. Answer C. Agranulocytosis. Rationale: clozapine can cause severe drop in white blood cells. Strategy: clozapine equals close watch on WBC. (39) A patient prescribed levodopa-carbidopa should avoid which high-protein meal at administration time? A. Oatmeal. B. Steak and eggs. C. Salad. D. Apple slices. Answer B. Steak and eggs. Rationale: high protein interferes with absorption of the medication. Strategy: levodopa equals leave the protein at dosing. 40. Which is a common side effect of metformin? A. Constipation. B. Lactic acidosis. C. Hypoglycemia. D. Vision changes. Answer B. Lactic acidosis. Rationale: metformin can cause rarely lactic acidosis, especially with kidney issues. Strategy: metformin equals monitor lactic. 41. Which lab is important before starting statin therapy? A. AST/ALT. B. Creatinine. C. PTINR. D. Platelets. Answer A. AST/ALT. Rationale: statins can cause liver damage. Baseline liver enzymes are needed. Strategy: statins scan the liver. 42. A nurse is preparing to give acetylcysteine. This drug is used as an antidote for which overdose? A. Aspirin. B. Acetaminophen. C. Benzodiazepines. D. Iron. Answer B. Acetaminophen. Rationale: acetylcysteine protects the liver from acetaminophen toxicity. Strategy: A for A. 43. Which is a sign of theophylline toxicity? A. Bradycardia. B. Tachycardia. C. Constipation. D. Low blood pressure. Answer B. Tachycardia. Rationale: high theophylline levels stimulate the heart excessively. Strategy: think fast heart. 44. A nurse should question a prescription for propranolol in a patient with which condition? A. Hypertension. B. Asthma. C. Migraines. D. Essential tremor. Answer B. Asthma. Rationale: non-selective beta blockers can cause bronchoconstriction. Strategy: propranolol equals problem for lungs. 45. Which lab is most important to check for a patient taking vancomycin? A. Trough level. B. PGIMER. C. Blood glucose. D. Sodium level. Answer: A. Trough level. Rationale: trough ensures therapeutic levels without toxicity. Strategy: Vanco equals verify trough. 46. A patient taking fluoxetine should be taught to watch for which dangerous complication? A. Serotonin syndrome. B. Stevens-Johnson syndrome. C. Agranulocytosis. D. Hypoglycemia. Answer: A. Serotonin syndrome. Rationale: symptoms include agitation, hyperreflexia, fever, and sweating. Strategy: fluoxetine equals feeling too high, serotonin. 47. Which medication is given to reverse magnesium sulfate toxicity? A. Calcium gluconate. B. Sodium bicarbonate. C. Protamine sulfate. D. Vitamin K. Answer: A. Calcium gluconate. Rationale: calcium gluconate is the antidote for magnesium toxicity. Strategy: magnesium equals manage with calcium. 48. Which vitamin should be given with isoniazid to prevent neuropathy? A. Vitamin B6. B. Vitamin B12. C. Vitamin C. D. Vitamin D. Answer: A. Vitamin B6. Rationale: pyridoxine equals B6 prevents peripheral neuropathy caused by isoniazid. Strategy: INH equals I need help, B6. 49. Which lab is monitored to evaluate effectiveness of heparin therapy? A. PGIMER. B. APTT. C. Platelets. D. Hemoglobin. Answer: B. APTT. Rationale: APTT reflects clotting time with heparin therapy. Strategy: heparin equals hourglass with APTT. 50. Which statement shows correct understanding for a patient prescribed Bisacodil? A. I can take it daily for months. B. I should use it only for short-time constipation relief. C. I can take it with milk. D. I can chew the tablet. Answer: B. I should use it only for short-term constipation relief. Rationale: long-term stimulant laxative use can cause dependence. Strategy: Bisacodil equals brief use. Thanks for watching Nclex Made Easy 91, where we make nursing simple and success inevitable. If you found this helpful, hit like, subscribe, and turn on notifications so you never miss your next study boost. See you in the next video.